Hello, I'm Dr. Jason Hoover. I'm a staff neurosurgeon at St. Joseph Hospital here in Bryan, Texas, and I work with Texas Brain and Spine Institute. I just want to talk today a little bit about neck and arm pain and low back and leg pain, how those symptoms present, and potential treatments, both non-operative and operative treatments. So for example, if you're dealing with neck and arm numbness, tingling, pain, maybe loss of function, it could be because a pinched nerve coming out of your neck from your spinal cord is being compressed upon. These nerve roots are very small, and when they get squeezed, they can cause both sensory or feeling abnormalities like pain, but also weakness or loss of function. The same thing can happen in the low back as well. The nerve roots down there can be compressed, and you can have leg pain, numbness, and tingling, but also loss of function. If you're having any of those symptoms, it's important to get it checked out with x-rays, sometimes CTs, MRIs, and we can arrange for non-operative management such as physical therapy or steroid injections, and if necessary, surgery.